You know that moment? A slip of the knife in the kitchen, a fall on the pavement? We've all been there. But what you do in those first few minutes, that can make a huge difference. We're talking the difference between a quick heal and a nasty infection. So let's get into the simple, proven steps to handle it the right way. So, are you cleaning your wounds all wrong? It sounds like a simple question, right? But the answer? Well, it might just surprise you. See, a lot of what we think we know about wound care is just this tangled mess of old wives' tales and myths. Today, we're going to unravel all of that. We're going to focus on the clear, evidence-based steps for cleaning and dressing a wound the way it's actually supposed to be done. All right, so before you even think about reaching for a bandage, hold on. The very first step is to figure out what you're actually dealing with. I mean, you can't treat it properly if you don't know what you're facing, right? So let's break down the 3 most common types of wounds you're likely to run into. First up, we've got the abrasion. You probably know this better as a scrape or, road rash. The thing is, it often doesn't bleed all that much, but man, can it be painful. That's because a ton of nerve endings are suddenly exposed. The key thing to remember here is the risk of infection, especially from all that dirt and debris that can get ground right into the skin. Okay, next is a laceration. Now, this isn't your clean, straight cut. A laceration is more of a tear, which means the edges are going to be jagged and irregular. And because of that, the potential for some pretty significant bleeding and tissue damage is a lot higher. It really all depends on how deep that tear goes. And finally, we have the puncture wound. And this one can be the most deceptive of them all. Don't let it fool you. The opening might look tiny, like you just stepped on a nail, but the damage can go surprisingly deep. This creates the perfect storm for an infection. Bacteria get pushed way down inside where there's not much oxygen, and that is the perfect breeding ground for really dangerous germs, especially tetanus, to just thrive. Okay, so you've figured out what kind of wound you have. Now what? Well, now comes the most important part. Cleaning and covering it correctly. Seriously, these 2 steps are your absolute best defense against infection. If you get these right, you've pretty much won half the battle right there. So for a simple, shallow wound, the process is really straightforward but absolutely crucial. Step 1. Always start by washing your own hands. Then you want to gently wash inside the wound itself with some soap and water. But listen up, because the single most important step is this. You have to flush it really well with clean running water. It's that physical action of washing everything out, the dirt, the bacteria, that does most of the heavy lifting to prevent infection. Okay, now we need to talk about a huge myth. I mean, this one has been passed down for generations. I am almost certain you've heard this before. Oh, you need to let that cut breathe. It needs to air out to heal. It kind of sounds right, doesn't it? But you know what? The actual science tells a very different story. Yeah, it's completely false. Leaving a wound uncovered just creates a big, thick, dry scab. And that scab? It actually slows down healing because it acts like a barrier, blocking new skin cells from moving across the wound. The modern, proven way to do it is to keep the wound moist and covered with a sterile dressing. That environment actually speeds up healing, can reduce scarring, and most importantly, it keeps that risk of infection way, way down. So we've gone over the do's, but what you don't do is just as important, I'd argue maybe even more so. So let's dive into a few really common mistakes that can actually hurt the healing process and turn what was a minor injury into a pretty major problem. First up on the don't list, you know that classic brown bottle that fizzes? Hydrogen peroxide. I know, the fizzing makes it look like it's doing something amazing, right? But it's a huge don't. The problem is, peroxide doesn't pick and choose. It kills the healthy new cells that your body is sending to heal the wound just as much as it kills the bacteria. And that just slows the whole process down. Okay, next. When you see a really dirty wound, I know the instinct is to just get in there and scrub it hard. You have to resist that urge. Aggressively scrubbing doesn't just clean it, it actually damages the already injured tissue even more. Remember, a gentle wash and a good, thorough flush with running water is way more effective and so much less harmful. Now, this next one is really, really critical. If a wound is gaping open, please do not try to be a hero with some butterfly bandages from your first aid kit. Taping a deep, dirty wound shut is one of the worst things you can do. It just traps all of that nasty bacteria inside. You're basically creating a perfect little incubator for a serious infection. That kind of wound is a job for stitches, not for tape. Oh, and we have all been there. You go to change a bandage, and it's totally stuck to the wound. The absolute worst thing you can do is just rip it off like a cartoon character. You're just going to tear away all that new tissue that's been working so hard to heal. The simple trick? Just soak it. A little bit of warm water will soften everything up, the adhesive, the scab, and let you remove it gently without setting your healing way back. Look, you can absolutely handle most minor cuts and scrapes at home. That's what first aid is for. But a really crucial part of good first aid is knowing your limits. So let's talk about the really clear signs that tell you it's time to put the first aid kit down and get a professional involved. All right, these are the situations that are just not negotiable. They absolutely require medical care. For instance, any animal bite, or even a human bite, those carry a super high risk of infection. A cut that goes over a joint, like your knuckle or your knee, could have damaged a tendon underneath. And of course, it goes without saying, any wound that's deep, gaping, or has something stuck in it, that needs to be seen by a doctor. Period. And then there are the absolute emergencies. These are the bright red flags that mean you stop everything and call 911 immediately. We're talking about bleeding that you can't control, like if you've applied direct pressure for a full 15 minutes and it's just not slowing down. This also includes any trouble breathing from a chest or neck wound, signs of shock like confusion or pale, clammy skin, or a deep cut to the abdomen. These are potentially life-threatening situations and you need help right away. Okay, so let's say you've cleaned and dressed the wound and the bleeding has stopped. That's great, but the job isn't quite done. Now we have to shift our focus to aftercare, and there are two big threats you need to watch out for. Just a general infection and one very specific, very serious danger, and that's tetanus. Tetanus, which you might know as lockjaw, is a really severe and often fatal disease. The thing is, the bacteria that causes it is literally everywhere, in soil, in dust, in manure. And even though we have a super effective vaccine, it still causes more than 70,000 deaths across the globe every single year. This is a completely preventable disease, which is why we have to take it so seriously. So here's the timeline you really need to remember. For just routine prevention, everybody should get a booster shot every 10 years. But that rule changes if you get a dirty wound, like stepping on a rusty nail. In that case, you need a booster if your last one was more than 5 years ago. And here's the most critical part. That shot has to be given within 72 hours of the injury. After that, it might not be effective. So when you really boil it all down, what's the takeaway? Effective wound care isn't about some kind of complex medical procedure. It's really just about mastering the basics. Clean it gently, flush it out really well, keep it covered, and avoid all those common don'ts that we talked about. And maybe the most important skill of all is just knowing when to say, okay, this is beyond me, and call for professional help. So, now you know the right steps to take. You know the myths to ignore and the red flags to watch for. But all that knowledge is only as good as the tools you have ready to go. So, I'll just leave you with this one question to think about. Is your first aid kit, the one in your house, in your car, in your backpack, is it actually ready for you to put all this into practice when you need it the most?